So I'm the director of the Familial Cancer Centre, which is a specialist clinic that aims to assess and then manage women who have a special risk of cancer due to something they've inherited. Because we're dealing with an unusual situation where you have this special knowledge about a risk for the future, it raises a lot of really challenging issues for people. And a genetic counsellor is somebody that can work with people to help understand, first of all, what that information means, and then help them understand what they want to do about it and their own personal choices to try and manage those kind of risks. And that's going to be different for everybody, so a counsellor helps people work through all that together. Genetic information is very unusual in the sense that it tells us something about the future, and knowing that someone has a risk of cancer based on their genetic makeup really puts us in a strong position to offer things that can help change that risk and change the likelihood that they'll experience something like that in the future. But it is an unusual bit of information, and understanding it first and knowing what it means is quite a challenging process. And then knowing how you're going to use that information to actually change those risks, again, it's a very specialised area, and those sorts of choices can be relatively straightforward things like reminding people to live healthy lifestyles. But of course there are more options available if you are a person at very high risk. Then we can talk about increased screening for some types of cancer. And then for some cancers, and ovarian cancer is a good example of this, there really isn't any type of screening or lifestyle intervention which is going to make a big difference to somebody at high risk. And so then we get into a very different kind of conversation, which is about the option to do something more dramatic, like have an operation to have your ovaries removed. And that's not something anyone would consider normally, but for women who are at high risk of such a significant condition as ovarian cancer, then that is something that people do consider. And in fact, where we are able to pinpoint a high genetic risk, we know from our experience that most women will want to go on and consider an option like that to reduce their risk. Traceback is really important, and it's part of a movement around the world to recognise that there are opportunities in genetic testing to provide really important information to people about their future risks, and the best known is where there is a strong family history and people recognise it. But there are other scenarios where we can see that genetic testing would be useful. And Traceback is thinking about more broadly about the people that we could help through genetic testing. And one group that we know we could do more for is the people where there has been a diagnosis of ovarian cancer. Ovarian cancer is an important cancer from the point of view of genetic testing. It's amongst the cancers where there's the very highest rate of gene mutations underlying it. And every time an ovarian cancer diagnosis is made, one part of that is an opportunity to think about the underlying genetic risk and to make sure we're taking that opportunity to use the information to get the greatest benefit for other family members. Many times, because of the type of condition that ovarian cancer is, that opportunity is lost when someone dies from the condition. Traceback is about making sure that we continue to push on and get as much benefit as we can out of that information to extend that to as many family members. And so it's taking our standard model and stretching it as far as we can to get as much benefit for other people that we can.